Okay, well, for every mother going home, we want them to be aware that they can get in contact with us in the lactation department by phone. If they ring through reception, they can be put through to us directly or through the office, and we'll return calls if there are any queries or advice needed. For a lot of our mums who are attending the community midwife team, they will see the community midwife within 48 hours of going home. So that would be the first line of support. They will then see the public health nurse within a couple of days. So the public health nurse is definitely a big line of support out in the community, and she should be able to direct each mum to different services that are available in her particular area. There are a lot of peer support groups out in the community now. Because of the situation in the country at the moment, some of these are on hold, or some of them are actually having virtual meetings. So it's important, go online to the local support groups, Lalesh League, Cuidiú, Friends of Breastfeeding, get the contact numbers, get in contact with them either by email or by telephone. If it's a thing they have virtual groups meeting, then it's a good idea to get in contact. And indeed, not just on discharge, we would encourage, antenatally, we would encourage mothers to get in contact with these groups to try and get some extra support to prepare you better for what your breastfeeding will be. Also remember, at 2 weeks you'll see your GP, and sometimes there are practice nurses available in the GP surgery as well. So this is another line of contact where you can have support. And at any stage, if you need support, GP or public health nurse can refer you on to other areas if you need, or you can get in contact with us here in the hospital. Okay, first of all, congratulations on 6 months of exclusive breastfeeding. So the one thing I will compliment you on is you have the experience behind you. So breastfeeding this time around should just come as second nature, hopefully, if baby works in tandem with you. With regard to combination feeding, of course you can do whatever you want to do, but what we would advise is try and get your breast supply up and running. So this will take a couple of weeks, putting baby to the breast exclusively, allowing baby to feed as much as possible so that it's exclusive breast milk. You have a good supply built up to meet your baby's needs, and then that gives you the options going forward from there to decide what way you want to continue with your feeding. Once you start combination feeding, you could express and you could give your breast milk in a bottle, but if you choose to introduce formula milk, every bit of formula that's given to baby is milk that's not coming from the breasts. So the breasts are not going to continue to make enough milk to meet baby's needs on a daily basis if you continue to give the formula. But if you are giving formula, I would say try and do it in a controlled situation where you do it at the same time on a daily basis, rather than just deciding at a different time every day, because that can really mess up your overall milk supply going forward. But we're quite happy to have a chat with you at any stage about this if you want to contact us for further information. Okay, this is always a 6-marker question, and what I would always say is every drop of breast milk is important to your baby, so the longer you breastfeed, the better. We talk about the benefits of breastfeeding and giving breast milk for both mothers and babies, and the longer you breastfeed, the greater the benefits. Now, globally, the World Health Organization and UNICEF would recommend that everybody would breastfeed exclusively for at least the 6 months, and then start to introduce solid food to complement the breast milk, but to continue giving breast milk with solid food right up until the baby is at least 2 years of age or more. So for us, we would say the longer you actually do it, the better. But my thinking is always don't put a timeline on it, because that's setting yourself up for disappointment. Start out your breastfeeding experience with the idea that you're going to do it for as long as possible. And remember, every day, if it's successful, leads into the next day. There are certain medical conditions. The one that comes to mind straight away is galactosemia. And this is a condition where babies are actually not able to tolerate milk and the components of milk. And for these babies, it would be detrimental for them to receive not only breast milk, but also the formula milks as well. So they need a specialised milk. there is part of the national, the neonatal screening test detects this condition. So for some babies that are more at risk of the condition, or where there's a known family history of it, these babies will be tested straight away after delivery so that the results will be back very quickly, and they will be fed an alternative substitute until the results come back. But the majority of these tests will come back normal, and babies will go on to feed either with breast milk or formula milk. Again, going back to what we were talking about earlier, I would advise not using formula milk. If your plan is to exclusively breastfeed and you want to be meeting your baby's needs with your breast milk, then it's important not to try and introduce formula, because for every drop of formula that's used, that's milk that's not going to come from the breast. So overall, what it will do is it will actually it'll interrupt the supply of milk and can affect the overall supply. So if you want to exclusively breastfeed, then it's better not to introduce formula. But there are some situations, if you have issues with supply and you don't have enough milk to meet your baby's needs, that you need to introduce formula, and that's totally different. Sometimes in the early days, a temporary situation, it may be important, it may be necessary to actually introduce some formula. But this would, if it's a temporary situation and you want to be giving exclusive breast milk, then we need to be taking the measures to get you to try and increase your milk supply, so that as your supply increases, you can reduce down the formula use. But again, it goes to personal choice. Okay, generally what I would say, whatever your normal diet has been throughout your pregnancy, baby has already been exposed to that. We always promote a healthy, balanced diet. Make sure you're taking everything in moderation. So it's not a good time to start taking big amounts of one particular food and leaving out other foods. Everything in moderation. When it comes to tea or coffee, anything else, any other drinks with caffeine, I would limit it to 3 to 4 altogether in a 24-hour period. So you're talking about your tea, your coffee, the likes of Coke that will have caffeine included in it. So anything with caffeine in it, it's better to limit it no more than 3 or 4 cups in a day, because the effects of the caffeine can be seen for both you and baby.